Thank you so much. What amazing studies. I look forward to everything that's still to come. Our next speaker is unique in having one of the most diverse views of occupational health and safety risks in Australia. As an advocate for the importance of clean air at work, he's been active in recent campaigns to protect workers from deadly silica dust and the ban on engineered stone, as well as efforts to accelerate the removal of asbestos from the built environment. Liam O'Brien was re-elected as Assistant Secretary at the Australian Council of Trade Unions in June in 2024. Before joining the ACTU, he was a Victorian Assistant Secretary and National Vice President of the Australia Workers' Union, the AWU. It was there where he fought for the rights of workers across a diverse range of industries that the AWU represents. As a national official, he led the AWU's work in the aluminium, aviation, glass and construction industries. In his role as ACTU Assistant Secretary, Liam is responsible for leading the movement's policy, industrial and campaigning work on work health and safety and workers' compensation matters. He also leads the skills, education and training programs for the ACTU. Liam is passionate about the rights of all workers to safe, healthy and decent workplaces. He's a member of Safe Work Australia and the Asbestos and Silica Safety and Eradication Council, and is Deputy Chair of the Jobs and Skills Australia Ministerial Advisory Board. Over to you, Liam, to give us a workplace perspective on indoor air quality.
Thank you, Claire, and thank you, Plum, for this great opportunity to be here. I also want to acknowledge country. We're here on the stolen lands of the Ngunnawal people and pay my respects to elders past and present. I also want to join in acknowledging Lydia. I think it's great this week to see you recognised with the Prime Minister's Science Award, a recognition long overdue, one that our movement gave to you last year when we had you at our conference. So I'm glad that the government's finally catching up. It's a slow learner, that elbow. So I have a presentation too, but I'm going to move through it pretty quickly because I know we're running out of time. So as was said, I want to talk about health and safety. And I think health and safety gets a bit of a bad rap. Often a lot of people think about it as sort of rules, things you got to do. It's a little bit of nanny state gone wrong. But for me and for our movement, it is a rights-based framework because for us, I'm so glad Lydia talked about the right to health. The right to a healthy and safe working environment is a fundamental human right. 2022 is clearly a big year because it was a year where the right to a healthy and safe working environment became a fundamental human right. So I want to touch on that. I want to touch on air quality because, as we said, this is something that our movement has been very passionate about and done a lot of work on in recent years, and it's something that I think gets overlooked in terms of its impact in workplaces in terms of health. And I want to touch on a few other things, but then I want to move on to, as I said, indoor air quality. So as I said, the right to a healthy and safe working environment is a fundamental human right. In 2022, the ILO, by consensus, agreed that health and safety sits alongside all other fundamental rights, which means every member country of the ILO is required to implement policies and practices that ensure worker health. I think proudly, we're in a country here that was the first in the region and the second globally to ratify that fundamental right. And so when we think about it as a rights-based framework, this is really critical. It's not just a set of rules, it is a set of rights that really allow workers to organise in their workplace, allow them to cease unsafe work, allow them to be consulted about how work is organised and in particular the risks that work poses. It's about being trained, it's about having a right to know. And so when we think about this in the context of indoor air quality, this is a pretty fundamental framework. And as I said, it's protected by ILO conventions, but importantly, it is secured in Australia in our work and safety framework. I think what often gets missed when we think about work health and safety is we often think about incidents that happen at work. And indeed, every year, roughly around 200 workers lose their lives. Safe Work Australia published the data a couple of weeks ago. Last year, 188 workers lost their lives. So it has been a pretty steady stream of fatalities over the last 10 years. That number has not budged much in the better part of a decade. But I think what people forget is that actually air and deaths caused by air is significantly larger. Those are just two airborne contaminants, silica and asbestos. Now, the two are the worst, and indeed, if we think about our historical use, legacy issues associated with asbestos, despite banning asbestos for production and use 21 years ago, we still lose 4,000 Australians every year to mesothelioma and asbestos-related disease. But it doesn't count things like diesel particulate, welding fumes, all of the other pollutants that kill workers every year. But I think it's important to acknowledge, because I think this is something that doesn't get nearly the appreciation in the public's mind. Claire talked a little bit about silicosis. This is a disease that we had long thought we had eradicated in this country. Disease that really was a product of the early part of the last century, preceded asbestos when we think about its consequences. You know, this here is Anthony. He was a stonemason. He was 36 years old. He had worked for 10 years in working on engineered stone. He died in 2019. He was one of the first engineered stonemasons to die. As of 2023, 1 in 4 workers who worked with engineered stone have been diagnosed with silicosis. This is a product that is a fashion item, something that is not an essential building material, and was claiming as many as 1 in 4 workers who worked with it. And it sparked a pretty significant response in our movement. You know, I said before, silicosis has been something that we had long thought had been eradicated. And to see it re-emerge with such ferocity really led our movement to take an approach similar to what we did in the last century in relation to asbestos, which was to move to ban it. But actually, 600,000 workers in this country are exposed to silica every day, from mining, construction, tunnellers that we see in our big cities like Melbourne, Sydney and now Adelaide, constantly exposed to silica dust. And so we've also now got some of the world's best regulations when it comes to silica, some of the lowest standards when it comes to crystalline silica. We're also nearing the end of a very long overdue process when it comes to other airborne contaminants. And Suman talked about other pollutants. I mentioned welding fumes before, but indeed nitrogen dioxide, diesel particulate, all of these we are about to land new workplace exposure limits, significantly lowering the levels for over 70 airborne contaminants that cause significant harm to worker health. So what I'm trying to say is we've had a pretty good track record in recent years, both elevating the issues of poor air quality, but indeed really progressing better regulations through our work health and safety framework in relation to these areas. We're about to kick off some work in relation to lead, a really significant issue in workplaces, but indeed an issue that affects the entire community. And Suman touched before in relation, you mentioned asbestos. It's pretty troubling that we're still losing 4,000 people every year to asbestos disease. What people are most concerned about now is the fact that we still have 6 million tonnes of it left in the built environment. Every one of those products is well past their use by date, installed better part of the last century. All of them likely to be degrading. All of them likely to expose workers over the course of the next generation. If we do not remove this asbestos quickly, we will continue to see fatalities. The Asbestos Safety and Eradication Agency says that we will see as many as 30,000 fatalities due to asbestos over the course of the next century if we do not accelerate the removal of asbestos. So there's a lot of things happening when it comes to air. We're also now picking up things, like was mentioned before, in terms of airborne pathogens, and we're about to introduce a biological hazards code of practice, which we're hoping to see next year. And this is where I really think some of the work that others have spoken about can come together when we think about work health and safety. Because work health and safety is, as I said, a rights-based framework. It is dynamic in that it doesn't just address some hazard, it addresses all hazards to health. But it also has a pretty good regulatory framework that we think in relation to air just needs a few things to be plugged. We do have regulations in relation to ventilation, but we don't actually prescribe any performance standard that it's supposed to be. It literally just says ventilation that is beneficial to your health. We have no practical guidance that actually talks about what that should look like. And we're just about to commence some work in relation to a code of practice on managing the environment and facilities, something that we think can start to pick up on the great work of Lydia and others. But the last thing I wanted to touch on, which I think is really central to this conference and the discussions that you've been having throughout the morning, is that indoor air quality is an equity issue. It is a significant accessibility issue. And if we just look at some of the data that's come out, and I want to thank Alison Roy, who I think was here this morning possibly, who shared this with me a couple of months ago, we've seen a significant impact in people that are unwell and not participating in work. And indoor air quality is a huge barrier, both in terms of accelerating those illnesses, but preventing people from being able to participate in work. And there's a huge opportunity for us as a country to improve that situation. And we think as a movement, this is a fundamental issue for us to continue to campaign for. We really look forward to working with many people in this room as we start to think about some of those policy pathways. And what I want to implore on people here today is that work health and safety framework, fundamentally a rights-based framework that gives workers agency in workplaces to actually affect change, is a really powerful tool. Now, if we think about this building, where we are right now, work health and safety law applies. It applies literally everywhere outside of your home. And so it is a huge opportunity for us to tinker with that framework, close those knowledge gaps that others have spoken about, but fundamentally give workers that right to health and the right to a healthy and safe work environment. So on that note, I'm going to leave you because I know we've got a panel to come up. So thank you.